Good morning, everyone. I'm Serene, one of the scholarship officers with Healthcare Scholarships and Talent. To start off, a warm welcome to Day 11 of the Healthcare Scholarships Virtual Experience 2021. For those who have attended the earlier sessions, welcome again and thank you for joining us for this segment. Welcome to Making a Difference in Community Care, Center-Based Care with NTUC Health. NTUC Health Co-operative Limited is NTUC's social enterprise that provides a comprehensive and integrated suite of quality and affordable health and elder care services to meet the growing needs of families and their dependents. Specifically, NTUC Health will be sharing insight to center-based care delivery for seniors and around meaningful career opportunities in one of the largest and leading elder care providers in Singapore. In this session, we'll learn more about how NTUC Health provides the right size care solutions and supports seniors to live well and age actively in the community. Before we begin, we have a few housekeeping rules. Firstly, if you have any questions for our speakers, please feel free to type it into the Q&A box. If you would like to direct your question to a specific speaker, please kindly indicate it into your question. And lastly, if you do see a question that you're interested in, please upvote the questions. We do have a short time of Q&A at the end of this session. Secondly, we do have an ongoing leaderboard and contest section for participants to win attractive prizes such as Universal Studios Singapore one-day pass, Disney Plus subscription, Grab food vouchers, and many more. I would like to introduce the two speakers that we have for today's session. So firstly, Ms. Joan. Ms. Joan Tay is the head of human resources at NTUC Health. She believes that it's important to nurture staff capabilities so that they grow with the company and continually provide quality services that meet the rising and changing needs of families and their dependents. Secondly, hi, Ms. Irene. Ms. Irene Toh is the head of Allied Health with NTUC Health. She holds a master's degree in clinical physiotherapy in manipulative therapy from Curtin University. Irene brings with her invaluable experience and constantly challenges our Allied Health team to keep innovating to better serve our community. So now I'd like to pass the time to both Irene and Joan, please. Thank you.
Hi, a very good morning to everyone. I am Joan. Joining me today is a great colleague of mine, Irene Toh, who is the head of Allied Health, and she's a therapist herself. We are happy that you have chosen to spend the morning with us today. Both Irene and myself would like to share some very useful and important information about our community care and about the work that we are doing in the sector. In this morning, we have put together 3 parts of our presentation. Part 1 will be around how we share about healthcare trends and some of the key outlook. Second part will be around the myth and a little bit about NTUC Health and what do we stand for. And finally, we are going to end the session with some career and learning opportunity to share with all of you on the call. With this, over to you, Irene.
Thanks, Joan, and a very great morning to all our audience and friends today. I hope everyone is feeling well and superb today. If you are, please smile, though I can't see you. All right, but I hope you have a good time and morning with us. Just sharing a little bit of information here, which I think many of you might be already familiar. The diagram shows us that in reality, what Singapore is expected or already currently facing. Do you know that in 10 years' time, 1 in 4, a person in Singapore will be over 65 years old? This is really an increase of nearly 8 times in those over 65 years old in just over 60 years, from 1970 to 2030. Right? This makes Singapore really one of the fastest aging country in ASEAN. And do you know what is the current life expectancy of Singaporeans? Okay, next slide. Yeah. Okay, right. So, this is an article from Straits Times, and we are really, we are in Singapore. Our life expectancy, right, of average Singaporean is expected to be at 85 years old. We're really right at the top, with countries like Switzerland and Japan. And women tends to outlive men. But the gain in years being alive is not the same as the gain in years being in good health, right? So next slide. Right, we know that many spend the last 10 years of their life in poor health, right? And the leading cause of poor health is related to bone and joint conditions, as well as mental disorders such as depression, anxiety. Right? It doesn't really show us a good picture in the future of what we're expected to face. And we know that many adults do develop 3 or more chronic diseases, right, by the time they're in their 60s. Right? So this is actually one of the reasons why I joined the community care sector. Besides my love for working with older folks, right, and keeping them healthy as long as possible, I do see the opportunity in, preventive health as well in the community. As a therapist, I am, in a position to influence many people in different walks of life to have a better quality of life and health. And not just, when they are in need of rehab, when they are down with some injury or a medical event, right? So Joan, perhaps as a HR head, how do you see this industry, right? Do you see any shift in the last few years, from, all this data that we have already presented?
Thanks, Irene. Very good to share a little bit about the public news. But we now go on to look at some healthcare industry outlook. And we actually extract the next number of slides from the Department of Statistics. Okay, you will have heard that Singapore has an aging population, and here is a set of data from the Singapore Department of Statistics, and we are sharing 3 key trends. By 2030, the number of seniors aged 65 will be doubled from 47,000 to 83,000. This also simply means that there's a lot more seniors in our community, and it also presents opportunities to design new products and services to cater to this group of seniors. A second key trend on the next slide shows that from 2018 to 2030, our seniors age 65 is going to be doubling. Today, our ratio from age seniors against the younger population 4:2. But by 2030, it's going to be 1 young person supporting 2 seniors. And potentially, this means that our senior either continue to stay independent for as long as possible and reduce the reliance on the younger workforce, or it will actually depend on people like us in the elder care sector to provide the support system to look after our seniors. And the last key trend, actually, which is the most worrying of all, that 37% of our senior workers or our senior adults are going to be we're going to be hit with a chronic condition around obesity, and also the danger of living alone. And Irene, what do you have to think about this?
Yeah, Joan, but I would say a word of encouragement to all our viewers today, right? It's so important to take ownership of our health, right at the early age, and not to start when we start to have chronic disease or medical conditions. So everyone, if you're listening in, really start an exercise program today. Being a physio, I want to say this, it can be as simple as walking 10 minutes a day and building up to 30 to 45 minutes over time, okay? Everyone must do something today for our health tomorrow. Of course, Joan, with the trend you presented, right, it definitely tells us that we really need more people in the community care sector, right, so that we can better serve and care for our seniors and support families as well. Are there really challenges in getting people to join us?
Yes, indeed. But we are like many other industry out there. Each industry will have its unique challenges and job opportunities. In our community, what I do see, there will be a drastic change from today because we are going to be the sunrise sector. There is almost like new product and services that's going to be popping up to serve this new population, and we are actually starting to shift and behave in a more like a startup manner to be more agile and more adaptive to the change of our senior population. And some of the challenges that we face today include changing our manpower regulations. We face stiff competition hiring directly from large healthcare institutions like the hospital and private institution. We also face challenges across the overseas where the nurses are attracted to other locations in Singapore, outside Singapore. But we believe all these challenges actually provides us with even more exciting opportunity to develop a people strategy or program to support the development of our people through training, to development, to job rotation across different settings. Stronger people practices will be emerging from this sector because the need to both retain our current workforce and attract new people or new students or new people coming in to join our sector. Experienced workforce out there who have access or experience in critical thinking or service mindset or have led strong or large teams will also be attracted to join our sector because of the highly transferable skills that they have. And the next section, right, we are going to share a little bit about the myth about our sector. So myth number one, I will never be able to find a job in the sector because I'm not trained in any course in healthcare or elder care related. And Irene, what do you have to think about this?
Yeah, actually, I hear this quite often. I would say the most important value to process, right, is your passion to work with people. And in this community, right, it would be the older adults and the seniors. So that our industry is definitely also not just focused on medical aspect of health, right? Health cannot be without social, right? The idea of community and befriending services, physical, emotional, and mental well-beings are very important to as a holistic approach to well-being and wellness. So we definitely, need more people from diverse backgrounds, right, and experience to engage our seniors, our clients, in a variety of meaningful activities or programs to help them age well and live well. You know, I guess, Joe, you might have heard that recently we have converted one of our laundry assistant in a nursing home to a
Yes, I
therapy
have.
assistant. Yeah, so we are quite glad that she's able to join us and also bring joy to our senior because she's so happy to work with the seniors. Definitely experience may be important, but most important is really the heart to serve.
And the attitude as well, actually.
Correct. Yeah.
This is great, Irene. When I first joined the community care sector 2 years ago, right? One of the very common question I get asked, do I have to work with the dying? And Irene, what do you have to share about this?
Actually, from what I have seen so far in the community care sector, right, it's really so much more, right? From what I've seen in our outpatient rehab centers, home care and nursing home, we really serve clients with different rehab needs at different stages of life, right? Many of them are still active and wants to return to their hobbies, can it be it dancing or traveling, and we also assisted some of them to return to work or to be independent in the community as much as possible. So to them, this is a very meaningful this is something they look forward to life as they get older, right? And so you have shared that just now many of the seniors are expected to be staying alone in the future. So definitely they will need assistance and help to get them back on their feet. And sometimes for some seniors who are staying alone, they also just need a friend, and which is why we have it in our senior activity care centers and also in our active aging hubs, where there's a lot of a community of seniors who comes together to help one another to also serve the young, the frail, and the elderly, right? They find so much more meaning and purpose in their life, right? When they join us as volunteers, to create this kampong spirit within our
Mm,
centers, yeah, and outside as well, right?
ex-
So to that question, I would say we really serve people from very, very needs, right? And majority really wants to remain active and independent. Then, of course, Joel, I guess, now my turn to ask you a myth. I hear this all the time as well. And sometimes even my therapists, right, they're also quite concerned. I said, will they see clients who are, sometimes naughty and very difficult to work with because they are older and they have their own fixed mindset? But
Okay, just like you, right? The seniors go through all the own emotional and the social and the psychological changes and into aging. It is not something unique only to us or only to our seniors in the community care. For those of you who have done a part-time jobs or during your vacation, you did an internship in the service industry or in the food and beverage work, you will have encountered different clients and have very different needs. And the goal is really the trick or the goal is to really understand these needs and find our best to meet some of their needs attentively. And similarly, if we were to empathize the changes with active aging, right, you will find it extremely rewarding to be able to make a difference to one's life in the community setting. And more often than not, right, our senior actually develop a fond attachment to our staff. In the next session, right, I will be sharing a little bit about NTUC Health, because I find that a lot of the sector in the community may not be well aware of NTUC Health. Okay, in NTUC Health, right, we are actually part of this big family of social enterprise. Many of you will have been very familiar with our NTUC Fair Price. Actually, we have other social enterprise that comes along with it. For example, we have the food fair and the kopitiam that comes together, the food services. We have the childcare services under the NTUC First Campus, the insurance arm, which is NTUC Income. The NTUC Link is our service credit points system. We also have NTUC Learning Hub that provides learning across our nation. And last but not least, we have two new babies of social enterprise. One is Money Hour and Mercatus in the market. Okay. And in NTUC Health, I'm also very proud to share that NTUC believes in bringing happiness, dignity, and peace of mind to our delivering care good enough for ourselves and enough for our loved ones. We serve across the business that we operate in. We serve across, next slide. Yeah, we serve across individuals and working family with a range of services, from outpatient to dental and family medication or rehabilitation services, to services to seniors at care for at home, our senior daycare center of aging, our active aging hub, our social wellness, our case management, and also we provide 24/7 residential care services. Next slide. We also have grown quite significantly in Singapore in terms of the footprint. In 2014, we had about 18 dental clinics, 7 senior activity centers, 450 home care clients, and 3 nursing home and 10 daycare centers. By the end of 2021, right, we are going to be having 23 to 26 daycare center, 3 new nursing home, but 3 more coming up, 3 active aging hub, 10 senior activity centers, and island-wide home care services, and 18 dental clinic across the island. Now, Irene, what do you think about our philosophy on ageless senior means?
Yeah, Joan, I think, happy to share that in NTUC Health, we really not, we don't define clients by their age, right? Which is why we have this term called ageless seniors in our organization and in the programs that we want to design for them. You know what does really ageless senior means, right? It's basically someone who continue to live life meaningfully and, have the potential to contribute into the life of others as well, despite their age. Some of them may need some kind of support or help, as they get older, but it really does not stop us from applying this person-centered care philosophy on those we serve, right? Which leads me to share a little bit more about NTUC healthcare philosophy. In the next slide, we believe in these 4 guiding principles. First is choice, right? We believe that senior, even at no matter what is their age, they really have the ability to make choices and to set goals, pertaining to what they want to achieve. Right? We also believe in making them, and encourage them to be as independent as possible, even though sometimes they will need some modification or some kind of support. It really doesn't mean that we take over the task that they need to do for themselves for them. Right? This helps them to retain their sense of identity and self. Right. Thirdly, we strongly believe, again, social network and community is a very important part of health. So this will help the senior to be engaged meaningfully in their daily activities and in their life, and also to connect with people. Right. Lastly, we want to also seek to offer solutions to the seniors and the right services to them, not just providing them the things that we all offer and then giving them all full suite, but really what is their needs and how can we offer them the solutions, right? So that we can actually help them to age well in their golden years. Right. Next, I'm going to share some videos, right? This one is actually an activity that we have in our senior daycare. We have started to conduct modified sports in our senior daycare center to engage the senior. So over here, you see that the senior is actually engaged in a boxing program, but they're all seated in a very safe position. Right. Yes, the video, you can show the video now. Okay, yeah, the video should be coming out soon. Okay. Yeah, please enjoy the video.
Punch. Very good. Come on. Punch. Good.
Yeah, so the therapists, they will say that the seniors are really using their arm power, punch, right? And they're all having a good time because it's boxing. Many of them may not really done boxing before, but they punch and torture this person who is going around, for the seniors. Okay. Next, we have, just to show a little bit of the programs that we also conduct in our daycare, right? So we have programs like bingo, or even, letting the senior guess the favorite local food, or local events, through pictures, and help them to actually remember things, right? To trigger their memory as well. So because of the pandemic as well, we have to move some of the programs to online and to engage the senior as they're at home. So during that time, we're also glad to say that many of the seniors, because their family are also working from home, then they started to be a bit more engaged in the session as well, because they have help the senior to, log on to the Zoom, log on to our Google Meets, right? And they also get a glimpse of what their seniors, what their parents actually have, as activity with us, So hopefully, through this, the family members also continue to form deeper bonds with their loved ones, right, and engage them better in their daily lives, right? Okay. So next slide, I want to share about more closer related to me will be the rehab part. So over here we have Mr. Tan. Mr. Tan is actually our rehab client in one of our daycare, one of our rehab center. He actually came to us only just before circuit breaker for deconditioning after hospitalization for a period of time. Right, so imagine we only could see him once, and then we have to close our center due to pandemic. Right, so we were really, the therapists have to scramble to find how can we reach out to him, how can we continue rehab for him, though we cannot see him face to face. Right, so I'm very glad to say through the weekly tele rehab session, which we have conducted through, different social platform, different like WhatsApp, even Google Meets and MS Teams, right, to find what is the best mean to reach out to the seniors. We could actually get Mr. Tan to progress from being on a wheelchair to walk without any walking aids. So you can see the picture on the right bottom. Mr. Tan is actually pushing a chair when he's walking in the community, of course with his face mask on, and his wife is behind holding the video to show us. And that is really a tele rehab session right in the community with a senior doing community ambulation. Okay, so very glad to say Mr. Tan has attained his goal, which is really to have his cup of coffee, walk to this coffee shop near his home to have a cup of coffee, and we managed to achieve that together with him. Right. So next, this is also some of the ways that we have managed to leverage our technology and social media platform to still reach out to our seniors, right? Because we can't see them, so we really have to conduct. We take video of ourselves doing exercises, put it on our NTUC Health YouTube channel, right? And then send the link to the seniors, to the family so that they can play it with them and actually go through the session with them. So I'm glad to say even through our Zoom session that we conducted, we also have family members participating in the exercise together. So definitely reaching out to the family members to be part of the whole journey with the clients that we serve. Okay, so next, this is we're going to show a video that will give you a glimpse of what happens in our senior wellness center. Okay, so enjoy the video, everyone.
I would like to be active with mind and physical active, like to make us healthy. At home, we feel very lonely. Once you go out, you feel very alert and active also.
We just stay at home, we don't know each other, sit at home, nothing to do. Also boring, you see TV, you clean, nothing to do. So we join them and now we are all the time happy lah.
Time I come here, I not working because my knee operation. Then I jalan pakai tongkat. Now you see I'm very healthy. Tak payah pakai tongkat again. Then Raza ajar I pergi exercise, cycling, very harder and happy. Then become now I can walk already.
最喜欢就是exercise 咯，有时候完了跟他们坐在那边聊聊，要去浇花咯这些啦。
I've been doing it for some time, and I think the best part is to serve them in a very open heart.
I have parents, and eventually I will grow old also. I would like to treat them like how in the future my children will treat me.
Once I joined this activity, this civil club, then we know each other lah. So we got a lot of friends. Sometimes we after exercise, we invite them to come our house, visit our house. Sometimes they invite us to visit their house. So like family lah. So now we got a lot of friends.
We all mix together as a whole family, and we talk to each other. We share each other. They are really very fine. Even though they also They ask me to go up to their house, visit them. Sometimes we ask her to go to my house. They also come and visit us.
Hi everyone, I hope you're enjoying the good video that we had just presented a couple of minutes ago to give you some insights to how our centers are being run. I hear from the moderator there's some questions, Serene, there's some question coming in. I will try to cover some questions as I cover this part of the section about career and lifelong learning opportunities. In NTUC Health, right, there are two meaningful roles that I always try to promote and advocate. It's around the family of the therapist, and that's why today my partner is actually Irene too. One of the key things when I find as we age, right, our mobility is actually going to be prohibited because of the fact of our biological physical degeneration. And the role of the therapist assistant today, right, can be a career path leading into a professional therapist, which is visual therapist or occupational therapist. And this role has largely evolved a lot from the hospital environment. I don't know if you have experience in the hospital. Many times a therapist, right, when they attend to a client in the hospital, right, they sometimes actually treat the symptom for a client to good enough to leave or come back to the community hospital or even come back to the community. But what Irene's key focus is really not just about getting them up and well running. We make sure that it's sustainable recovery through their aging years, including up to age 85 and beyond. And today, right, our seniors, the recovery process, right, enables many of our seniors to continue to enjoy their activities around gardening, cooking, taking brisk walk. It's almost like as if they are living their life to the fullest, even as they age. And physical degeneration is not a prohibition of their activities. And with MOH funding on this professional careers in the community care, right, definitely, I think some of you who are the scholars, right, you can actually continue to pursue your master's and even PhD at the moment. And what is most interesting, in fact, one of the key members under Irene, right, is even doing a PhD in understanding physiotherapist work in our community care setting, which has very little opportunity to study this outside Singapore context. So I think this is a very unique opportunities for some of the scholars out there. The other areas that I have not purposely published here is around the work of the care assistant associate. There is a project ongoing partnering with MOH, right? We're now trying to develop this new career care, specialized or professional career in tending to the needs of the elder in a more holistic manner. Today, we have developed quite strong arm in therapist work. We also have a very strong clinical in nursing care, but they're still missing this element where we provide professional care for the aged or the seniors or the older adults. So akan datang, this is a space to really watch out for in the market. Okay, next slide, please. This is my little attempt to talk a little bit about the physiotherapy work, which is to really restore and maximize and maintain the client's physical function so that it limits the impact of the illnesses or the disability or any age-related changes. Maybe I ask Irene if you want to add.
Yes, Joan, I think you have, like as kind of want to do this because Joan has known me for a while, right? I said, hey, Joan, test you out. You know what I do or not?
Okay, next slide, please. On occupational therapies is about maximizing or maintaining the client's ability to live independently in the community. And what occupational therapists typically need to do is really to help the seniors to perform a list of daily living activities, making sure they are instrumentally able to live and work leisurely in both areas of cognitive processing, perception, and psycho wellness or psychosocial status. Okay, next slide, please. I do welcome you to join the path of the community care and be an everyday hero. In this particular sector, right, we are no different. So I will attempt to give some comparison to other industry or sector that you're comparing. MOH give us lots of funding to support your clinical progression. That's one plus that you definitely should consider, especially if you do want to upgrade your learning in the sector. Two is that what is unique about NTUC Health, we are one of the largest service provider in community care that provides care across 3 settings. What is those settings. One in the dental or FMC space, 2 in our daycare active aging hub space, and 3 in the nursing home space. So as a community care person, both clinically, professionally, or even as a care staff, right, you actually get to work across 3 different settings in a single organization, and you carry your learning and your passion within the same organization. And that, to me, I find is a unique opportunity in joining NTUC Health. The other key things about finding a space in community care, one of the things I realized when I first joined, right, about forging bonds and client relationship with the clients, right. Again, I use an example with the hospital. I almost think of the hospital like our Singapore airport custom, where client has a condition, they check into the hospital, they get treated, and they checked out. That is ideal in some occasions, but often and not, right, in true care, right, as you hear from Irene, right, true care is to carry the mobility of the individual to as long as possible into their 80s and even the 90s. And therefore, the ability to follow through your client, right, in seeing their ability to grow well and redeem or recover their mobility is such an important element in community care. And one of the things I find are very interesting in this sector, right, a lot of the partners or the business colleagues that I work with, right, they actually talks about the meaningful contribution they make into the community setting. I draw comparison from a financial services sector where I used to work in, where we always talk about revenue and performance outcome. And that is a very different language that I use in community care. So I find in Comcare sector, right, we talk about what is the impact we make to the community. We think about what are the difference that we are trying to change in the community. And this is one of those things that I find resonate with myself and even Irene in terms of generating a purpose in the work that we do on an everyday basis. And I find this quite meaningful with joining the community care sector. So I think that's almost the end of our slides. I think there are some questions to be asked, but one of the key jobs that I want to promote to some of you is we are now designing a graduate track for healthcare professionals over the next 24 or 48 months, right, where you join us, right. There is a structured roadmap and training curriculum to bring you all on board into the community care setting. This is something that I think is very important for all of you to know. It's a structured program. It runs for 48 months, especially curated by HR to make sure that we onboard people like yourself who are interested in Comcare and doesn't know where to start. And I think this is a great way to join the program. If you go on to our NTUC Health QR code link, right, you'll be able to see this job. It's called the Healthcare Graduate Program. Okay, with this, this is really the end of our presentation, and then we'll take some FAQ or Q&A questions.
Hi, Joan. Hi, Irene. Thank you so much for your insightful sharing. So we have come to the portion of Q&A, and we'll be chatting with both Joan and Irene regards to NTUC Health, and also some of I do see quite a number of questions with regards to how do I choose which setting do I go to, whether it's acute or community care, some questions with regards to career progression. So we will take all these questions, and for attendees who are still please feel free to drop in your questions in the Q&A function, and we will get to it. So for the first question, this is directed towards Joan. Does NTUC Health provide attachments for youngsters or youths who want to take part and just try to experience for themselves center-based care?
Yeah, the answer is yes. We do have opportunities. There are 2 or 3 areas you can come in. One is your school internship. When you're on school internship programs, right, you can apply to your school career office and want to request to do an internship program with NTUC Health. We have reached out, my team and myself have reached out to major learning institutions in Singapore. If there's anyone that doesn't know NTUC Health, please let us know, but we're quite happy to support your internship program. The second area where you can do is join us as a volunteer. So in Q2 this year, right, you will start to see our corporate website will publish all the volunteer jobs or micro jobs to be done in our setting. That's another excellent way where you can volunteer into the setting and get first-hand experience to know what's happening in our center.
Thank you, Joan. I think the next question should be more directed towards Irene. So what causes the rate of chronic disease for people that are age 65 and above to increase? I think this is more, I think the person is probably having a more personal question maybe for the parents or grandparents, would you be able to advise?
Sure, I understand. I think, you know, we share the slide about how, you know, people over 60 will have 3 or more chronic diseases in the future. Right. So I think what the key thing is really what we do now. You know, as mentioned just now, a lot of these chronic diseases like hypertension, diabetes, high cholesterol are related to healthcare, like related to lifestyle, right? Modify risk factors, things like diet, smoking, right? You know, or exercise, right? Which is really key to actually helping us to manage, you know, giving us better health in the future as well. Because we know that once you start to develop chronic diseases, the risk of having a stroke or having other medical condition will increase, right? Definitely exponentially. So to the person who's asking this question, really look, the key thing is really look at what we do, you know, with our life on a daily basis, right? And also, I think just now, just to share a little bit more as well, you know, I share about how even mental, you know, like mental illness is also rising up in Singapore, right? Perhaps people are getting a bit more aware about it and also seeking treatment. That's why we know that there are more people who come forward, you know, with issue of like stress or depression, you know, and also being in Singapore, I think that is probably one of the key reasons why we are, you know, facing a lot of stress, right? As we're all in a very fast-paced environment. So I think moving forward, I guess it's really to how do we manage our time? How do we, you know, spend the time, right, to invest in our health for the future, right? Looking into lifestyle, looking into exercises, and also even sleep, which is also very important factor to help us, you know, manage conditions, right? Yeah. So hopefully to the person who asked that question, that is useful for you.
Actually, one of the preventive, if you go on to the healthcare hub or even our NTUC Health corporate website, right, there's one very important concept called the active aging. How do you age? Positive aging and active aging. That there's a lot of research and reports out there already. So in your 40s and 50s, you actually kind of need to start prepare so that you can age well into your 60s, 70s, and 80s.
I think to our current students that are listening to us, I think this probably will be more applicable to their parents or maybe grandparents. So we do understand that I think, at least for myself, for my parents, they are a little bit stubborn. So it's really for you to actually go and bring about this healthy lifestyle, healthy, active lifestyle, and help them in this way so that when they age, they'll also be aging well. So yeah, so this is one key point that you can take away from this session. Okay, moving on to the next question. So besides seniors, are there opportunities to work with younger clients or patients and also caregivers as well in the course of our work?
Maybe I take a bit and then Irene, you can add
Sure.
on. Yeah.
Yeah.
In the daycare setting, for the seniors, right? It will be okay. What is happening in our current scene is like in the daycare centers where our seniors spends the day in the daycare center. Some of them actually comes with the caregiver, which is the maid actually. So one of the interesting development in this sector is that we don't just engage the seniors anymore. We actually even have to do some training for the helpers in the family to look after the seniors. So I find this what I call expansion of the ecosystem work in the elder care very challenging and very interesting at the same time. You no longer think about just the seniors' needs as an individual, just like a client or a patient checking to the hospital. You actually need to think about the ecosystem who looks after the senior. One, it could be the helper in the family. Two, it could sometimes be a relative or family members, like the sister or the cousins or even the grandchildren. And what we find in this ecosystem of the next of kin, we call that increasingly very complex. We have young workforce like yourself, caregiver for the grandparents. We have helpers, we have parents themselves looking after their parents in the sector. So very diverse ecosystem in terms of the next of kin. Irene, maybe you can share.
So maybe as a therapist, right, I really want to share that a lot of times, right, care is always better closer to home. Okay. So I think, you know, in Singapore, right, the healthcare landscape is like where, as a therapist, because I come from hospital setting, right? So a lot of times, a lot of clients go back to hospital for rehab. But you know, as I work and gain more experience, I realized that I would like to see see their rehab journey throughout. You see, and that is why that's the reason why I come to community as well, because I can start to appreciate how do I, you know, integrate them back to the community, back to the family. How do I involve their family members as well in the rehab journey or in their care journey? So I find that definitely our clients are not just limited to the older folks, because they are also going to refer. It's getting more referral for people, right, for adults who needs rehab. Right, and I think moving in the years to come, right, the government is also trying to push for rehab to be in the community, right? So you're going to see clients who are younger. In fact, if I may share, in our rehab centers, right, the youngest client we have is actually a 19 years old gentleman who had a road traffic accident, had spinal cord injury. So because we are able to care for them for a longer term for their rehab, we can actually expect to see them coming to us, because hospitals sometimes I guess because of the limitation of the acuity of the care or the focus of it, they will see more complex cases. So actually their rehab journey actually might be a little bit short, and then they are referred out to community, and that is where the opportunity for us as well. Yeah.
Thank you, Irene. If I may add to this question and what you have spoken about, one of the questions is that we believe that seniors will probably have their ups and downs in terms of emotion. So how do you provide support for them, or how do you actually train your staff to actually provide this emotional support to them, especially sometimes when we do note that some seniors have dementia and they get a little bit violent, or they may throw some form of tantrum. So how do you provide such emotional support to these seniors?
Thanks, Serena. I think it's a very good question. And actually, indeed, just adding on to it as well, we are also getting more seniors, right, with dementia as well. As we get older, as we have an aging population. So to that, I get this question from my staff as well. And I say the key thing is really be there, listen to the senior, listen to them, what they are actually trying to tell us. Sometimes they may not also be able to express themselves well, right, because of certain conditions. So we just have to make sure that we are able to try to understand what they are trying to inform us, listen, spend the time with them, and get to know them. So as part of the whole community care as well, we want to know what the clients really like. So we don't want to know who they are and actually what they really enjoy doing, so that from some of this their medical condition, their habits, or their hobbies, right, we actually start to know them as a whole person. And through that, building that rapport with them will enable us to actually identify what are some of the reasons they are feeling, emotional, or feeling not quite, comfortable, or not quite, able to participate on that day, right? Of course, the other part that we also been trying to emphasize is also connecting with the family members, right? So we will sometimes only see them for a certain period of time in our center, right? They spend the majority of time also with their family. So it's important to also hear in and check in with their family to see if anything else has happened, at home, that might have resulted in them being emotional or a little bit more upset on that day. Yeah.
Maybe I just add a little bit to that. In the community care setting, one of the things I noticed on my better care colleagues are people who actually have very effective and empathetic listening. They don't actually need to do a lot. Sometimes by just listening to the seniors, right, the activity itself actually already provide a huge comfort on reducing isolation and feeling of loneliness actually. So never in my career I realized that the power of listening is so pervasive in this sector. So that I may want to just add on to that part.
Thank you so much. Yes, it's really very important to listen to the seniors, because I think sometimes they feel like as though they are not being heard, and because of that there's some emotional, they feel a little bit angsty, or feel a bit angry with regards to the situation, because maybe sometimes they cannot remember what's happening, they do not know what's going on, and therefore this kind of emotion. So thank you, Joan, for this very very insightful advice of just really being there and listening to the seniors. Yes, moving on to the next question is, I think you guys have spoken a lot of having the heart to serve and also good attitude to join the community care sector. So other than these two portions, what other qualities do you look out for in a community care scholar, or someone who just wants to join the community care?
Yeah, so I'll take this as two parts. Part one is addressing the question around by the scholars. For all the, not just generally. One of the key things I notice people who join ComCare, right? The number one thing that you must have is the passion. And I say passion is not just about the heart to serve or even good attitude. The passion about wanting to make a difference in the community care is actually very important. Because when you have passion, right, everything that you look in the Comcare setting, right, is very unique to you, and you will always be looking at how to improve the way things are being done in the community care setting. And whether is it a job in Comcare or any career that you pursue, right, passion is actually very important. Try to find something that you really like and you think you will want to work on it for a long time, and that itself will drive your progression in your career lah. And I'm speaking assumption that all of you want to progress in your career to be good at something. Okay, directly into the Comcare, right? And I say this with the future of work in mind. There are a few attributes that is extremely important. One is adaptive thinking. Today we take people from hospital, we take people from a non-hospital group environment. But one of the key differentiating factor I noticed where some do better and others not as well. Adaptive thinking is very important. Adaptive thinking means that you look at something, you adjust, you modify, and you make it work in the setting that you work in. And that rigor, the agility, and the rigor of how you keep doing adaptive thinking and practicing it, right, is so important. The moment you have this attribute, right, I will almost say that you can actually be successful in almost any sector that you work in, as long as you are passionate in. That's how I look at passion and adaptive thinking. Maybe Irene, you have something to add.
Yeah, I would think it's also, like I said, I think just now I mentioned about being willing to work with people. It's very important because you are actually dealing with people and also trying to influence and impact their lives. So definitely, of course, if someone would tell me what if I'm introvert, like what if I enjoy talking to people or what, right? But I find that in healthcare, I guess there is a lot of opportunity. There's a lot of things that you can expand. So as I said, health is not just about limited to always a medical aspect, right? So if you consider the whole person, right, as a whole, and also how we want to be perhaps served in the future by ourselves, by other people who look after us, right? Then you actually start to think about things that you can actually engage, the seniors or the clients that we serve in, so that you actually create meaningful life outcomes together with them, right? So the other piece is really to consider person-centered care as well, because that is where I think in the community you get a lot of a very much more holistic approach to health, because of the different platforms that we NTUC have as well. So we got a lot of social activities, a lot of engagement activities, of course the rehab, and also the personal care aspect of health. So definitely a full suite of services in NTUC where we have the opportunity to be exposed to.
Thank you both for your sharing. In relation to that previous question regarding qualities that you look out for, so the next question is, what is the career progression at NTUC Health? NTUC Health. Sorry, are there specific developmental opportunities for scholars?
Maybe I take that question. The career progression in NTUC Health largely has two tracks. One is the clinical track and one is the auxiliary track. What do I mean by clinical track? So clinical track would be, earlier we shared some example of the therapies. What is not shared today is the nursing track, and also maybe potentially in future the care track. So for the nursing track, we mirror a lot like the hospital structure, but of course in the hospital you have acute care setting as the ultimate. In the nursing environment in NTUC, I will say that a director of nursing is actually possible, but a director of nursing is someone who have cut across 3 different settings, which is the residential care, home care, daycare services, and that will be the most ideal in getting the director of nursing role. In Com Specialty is a new track that we're developing, so akan datang you'll hear more on how we're actually going to provide a specialist track for this. On the auxiliary role, right, is really operation management related, right? One of the things that is very interesting in NTUC Health, I find that because we are almost like a startup. Today our headcount is about 1,200, and we're going to grow to 1,008 in about two years time. What is meaning to say that what this means to us is that there is a accelerated career opportunity to anyone who come into this sector. And recently I even made changes to our performance management philosophy to accelerate the growth or progression of our staff. Almost like a startup. If you watch your K-drama startup and how people have autonomy, how people have opportunity to make changes, when you pick an organization that is the growth mode, right, this is where it's very exciting because you actually are empowered to make a lot of changes in line with the change that we need to see in this sector. Yes, there will be some what I call regulation governed by MOH, some guidelines that prevent, but rest assured that there are processes and opportunities where we empower individuals who aspire to do different things for the Comcare sector. And this is one of the reasons why you guys should think about joining the Comcare sector, because it is a sunrise sector from a domestic and the regional landscape perspective.
Thank you, Joan. In regards to, because we do understand that acute setting, they have been there for a while now, and they probably have their career tracks all in place already. So the next question with regards to what you have just replied to, do you see that there's a limitation to the career progression in a community care setting as compared to an acute hospital?
If you ask me, the answer is no. Actually, in fact, because we are now in developing all this career progression, right? Honestly, is out there for anyone who want to make a difference in the setting. So that's one of the reasons why I think yesterday Irene was texting me, hey, why people must join NTUC Health. When it's very grey and ambiguous to some extent at the senior level, right? This means opportunities for some of you who inspire to take a leadership job in your early of your career days. And I think that's one of the most exciting moments for some of you.
Yeah, actually, John, may I add a little bit more to that in terms of career progression? So, I am I'm a clinician at heart, honestly speaking, but I do see that as the whole allied health team, the therapist track, we have people who are educators. Okay, so I mean, that is definitely a key track, beside a clinician, right? Being a good clinician is one thing, but being able to educate another person to let them be good clinician in the future as well, that's a very important aspect of actually passing on our knowledge and sharing our skill to the next generation of therapists. So definitely education track. And then of course we also Joe share about one of my colleague who is on his PhD journey. So definitely moving forward, we also want to develop this research track, because we know that we have a lot of research data overseas, right, about the long-term care in overseas. But I think in Singapore, those data are largely still there are still research. They are researched in this aspect already. But I foresee that with evolving healthcare needs and also different programs, we definitely need to fine-tune all this research capability in the community, so that we can actually know and provide really good outcomes for what we do on with our seniors, with our clients. Right. Then of course, in terms of management track, for whoever who wants to consider a path in the management role, definitely it is available in the community as well. Because I would say, really, as Joe said, we are really still growing and developing ourselves. In fact, this is almost like a canvas where you can paint, right, and also envision what it should be like. That being part of the journey to craft out this whole picture and draw this together with us, really.
Thank you, Irene. Thank you, Joan. Okay, next question I have for Irene. I would like to rephrase the question just a little bit. So how did you decide to go into the Comcare setting? So this, just a background on this question, is this person is actually asking whether how can they decide between both settings, acute and Comcare, and whether, if you may add, whether there's any differences in the qualities that you see in a person working in an acute setting and a person working in a Comcare setting.
Okay. I feel like giving this person my email address and then you can contact me. Okay, because I have so much to say about it. Well, actually, I have been in the hospital for 19 years, and that's where I get to really go through the different specialization in the hospital that is largely available because of the different specialty, right? Then as a therapist, I'm very interested in their journey after I discharge them. Okay, and this is the reason why makes me move out of the hospital. Nothing wrong with the hospital setting, because you also, in each individual place, as long as you're willing to learn and you want to explore, you always have that ability to grow yourself, right? So, but because after seeing that in the acute phase only and being able to see them for a number of sessions in the hospital, just because of the workload there, right, I decided that I have to move to community so that I can start to see the whole journey, right? And that also makes me appreciate what is really health and what is medicine, honestly, because then you realize it's not just about a pathology-based model or something like that, but it's a lot of bio-psychosocial aspect of health. And this is definitely a very big thing, has been a big thing for the past 10 over years already, right? But so as a therapist, I wanted to be a journey, right? I say it's always about a journey together with the client. And that is where also the uniqueness of bringing in the family members in is also much more pronounced, much more obvious in the community, because I see them every week. Now I can see my client every week, versus when I was in the hospital, I only see them maybe once a month. I give you exercise now, you go back and do, anything, you come back next month, and then they will come back with different exercises that are given to them. So I guess it's a fun part of it. Then how do you rectify it in acute hospital, in acute setting? Right. So again, different skill set, slightly different skill set, but in terms of standards, right, I'm also very keen, right, to really upskill the therapists in the community so that we can also uplift the sector and deliver the care based on really true measuring outcomes and through, knowing what exactly we do, and upskill and bring out the capability as well as the capacity of the therapists in the community. Right. I have a passion to really bring this, bring the level in the community up higher. That this is really my true calling here. So to the question, I hope it answers you to some extent. But if you still have further questions, I'm very happy if you can connect with me. Really.
Thank you, Irene. So maybe we can take a little step back, and then I think this question will be more with regards to NTUC Health or the Comcare setting in that sense. So question is, what are active aging hubs? Are these the same as senior care centers?
I take that question. Okay, active aging hub. Currently we have 3 active aging hub in Kampong Admiralty, Bukit Batok, and in Jurong. Active aging hub is actually a new concept introduced by MOH a couple of years ago. Basically, is to attract senior to come into the setting. The name itself says active aging on a voluntary basis and work on programs and initiative together. Some of the typical things that they do, which you see on media, right, is around cooking, gardening, getting active together, exercising routines, and all that. But the clients who come into the setting is mostly volunteer basis.
Thank you. Irene, do you have anything to add for this question?
I would say I think Joan has covered it very well. I say the key thing about the active aging hub is really it's like a community where the senior comes together, and the active aging hub becomes an extension of their home. You literally bring your home out and you share things. So I've seen how the seniors share cooking, share recipe, and they also help to serve our seniors in the daycare. So that is where they started to find meanings in their life as well, because many of them are kind of retired, right, and they actually have a bit more time to serve, and that is where I guess building that kampong spirit is a very key thing. Being a Singaporean, I think that's where the government is also looking for the community to serve one another, to build that ecosystem, to connect, and to also keep ourselves well.
Maybe I take a lens out of the Singapore context. I think recently I read an article from Economist. Some of you may make reference to that document. There is a report about UK having an increased number of lonely people. And then today in the Straits Times, I think it's this morning, Ministry of Japan, Japan has appointed Ministry of Loneliness because in the increase in suicidal and loneliness of the senior. So the concept of the active aging hub actually arises from that. So I must kudos to our government for having foresight to plan some of these things. Ideally, in a community setting, right, you want the seniors to come together in a natural way. It's almost like in school, you form project group with your friends, getting together with your like-minded people, similar. So in the senior community, right, you want people to come together, but by not doing anything in the community, right, if we leave to the seniors' own devices, right, A, they may not have the resource to do, B, they may not know, oh, actually there's such a thing that is existing in the community. And this community of seniors coming together will change according to profile as well. Today, the setting is that we have active aging people come on a voluntary basis. By the time I hit my 60s or the 70s, right, hopefully I already formed some network for myself to make sure I can age with a group of like-minded seniors and where we have similar hobbies, similar topics, and this is how I think we want to be able to promote active aging in the community setting. And this is one of our biggest advocacy about ageless seniors, actually.
Thank you, Joan. In your presentation earlier, Joan actually shared more about occupational therapists and physiotherapists within NTUC Health. So this student is actually wondering if there are any other allied health professionals, such as speech therapists, that are in NTUC Health.
Yes. I think Irene can add to that. Yes, we also do have, but today I think the services is not as demanding, right? Am I right, Irene?
Yeah, not at the moment in the community, but definitely in the years to come is coming. And we do have speech therapy service in our centers and our nursing homes.
Thank you. So moving on to the next few questions. What keeps both of you going in the community care? Because we do note that it's not easy to work with seniors and caregivers. So how do you overcome some of these challenges?
Okay, maybe I take a list stash of the question. So why Irene and myself looking at each other? Okay, one of the reasons why both of us were picked, or rather I picked her and she picked me to do this setting together is we both have something in common. One, we enjoy the work that we do in the setting, and actually, whatever that we do, right, we provide a different lens on how we see things to be done differently. Of course, in this area, Irene's specialization is in therapist work. For me, it's in HR. So for those of you who can go into LinkedIn, you can see I actually didn't come from a Comcare setting. I actually came from a financial services setting, and I've done HR, hardcore HR work for 13 years. I did 6 years technology rotation. And now coming back to Comcare doing HR, right, is something that I have deliberately choose because I wanted to practice my skill set in HR in a different setting. If I were to join another financial organization, I probably can get along quite pretty well. But when I come to the Comcare, boy, my first 1 year of first 18 months, I was shocked by the rigor of the regulation by the regulators. I was surprised by the ability to connect with the people in a different setting, and that has actually helped me in terms of putting in my lens as a HR person in designing product and services from a HR perspective into a community care setting. And I draw references from many things, from my past experience, from things I read, from connecting with friends like Irene in the setting to help me to understand what is unique in Comcare setting and how do we design HR programs in the community setting. If I were to do this job in another setup, say a startup or a hospital like HR, I will also have applied my HR lens, but again, I will design quite different program to the organization that I'm serving or working for. So in short, I'm quite a sucker for doing things differently and using my old trade. And I like this ability to continuously test myself and challenge myself constantly. But I must say, it's with some hard work and sweat. That one I must admit. and I'm very thankful to have a partner like Irene who teaches me and share with me a lot about how because she and I come from very different backgrounds. She's from hospital and I'm from a financial services. So I really appreciated her partnership in the last 2 years in helping me to understand the setting a lot. Irene, over to you.
Joe, I'm really still learning, and I find every there's always new things that comes to us in the community. Perhaps also because now I'm a bit more management role, I start to really feel that wow, there's a lot of things, and there's a lot of opportunity in the community where we can make change, right, and be an advocator of our seniors and our programs, and also be a voice for our clients. I felt because also the government is also really trying to do well for this community care sector. So there's a lot of opportunity where we can actually feedback to the government and to the agency. So I find for me it's definitely taking a leap to see what else can I do, and also contribute to society. I find that's one of the key things that keeps you going. Like I said, I think Joe, you mentioned about the challenges. That is true, and I think everywhere you go there will always be challenges. But it's also how we look at it and how do we keep our passion alive, right? Because I think the willingness to want to create a deal, to me, is a bit selfish. I would say, as I get older, right? How do I want the community care sector to be in Singapore? So how many more years I have to make a change? If I'm willing to do that. So that is the reason why despite whatever challenge it is, I think it's okay. Let's deal with one thing at a time and we move on. And always learn. I think always being really open-minded about things.
Thank you. So now this question is the flip side of the question. So what makes you enjoy working at NTUC Health?
Is there a flip side?
From challenges to what you enjoy the most.
I think I shared a little bit about that. For me, I enjoy making a difference to the community care setting. So I think there's a NTUC Health here, right? It's actually my colleague there, private, a pretty little lady down there, but she's, and maybe Grace, later you unveil yourself. So one of the things I enjoy about my HR work is to drive the change I want to see in the sector. So my HR team 2 years ago when I joined, right, one of my colleagues keep telling me, no, cannot be done, that cannot be done. So I actually literally have to tell him, no, from now on, you're going to tell me yes, and this is the 10 ways of how to get it done, instead of telling me, no, you cannot get it done. And fast forward now 2 years later, right, I see the change in him when he tells me that, hey, I think this is how we can design things, and this is how we can move forward things. And that actually gives me tremendous satisfaction. And I don't know, I can't say for him, But I think certainly I find this is a very enjoyable learning process for me. It comes with some wisdom. Sometimes we try and learn, and sometimes we learn together actually. So I think this is one of the things that when I look back, I feel quite proud of those moments. Irene, still got moments.
Right.
Yeah.
What I enjoy is like the different ways we can always touch lives in because of the full suite of services we have at NTUC Health, right? We have the wellness, the preventive part of active aging, right, through the active aging hubs and through the wellness program that we have in under Tango. And then we also have our rehab services and then home care services and then nursing home. So you literally can actually touch lives at different phases. So I do appreciate this part because of NTUC being, I felt it's being holistic in a way, right? Because you probably may not get it in other community partners or sectors. Yeah.
I have a question for Irene. So this is more of a personal question. So Irene, was there any memorable moments that you have had with probably your patients or your clients that has stuck to you until this day? It could be from your acute setting, from when you were in hospital or when you were in NTUC Health. Is there any like very memorable experiences that you had?
Okay, maybe I'll share. That really comes through. I'll share one in acute hospital. I'll share one that I have now recently. Okay, so I think in acute hospital, my first year of work as a therapist. By the way, I've always been wanting to be a therapist since I'm in secondary 4, and that is why I chose the path to go to A levels and then go to Nanyang Poly, which is where the program was initially in Singapore. Okay, so my first year of work as a therapist, I was seeing a client in a rehab ward. And this client has a motorbike accident. So he was riding to Thailand on a motorbike with his friend, and he had an accident. So he's a spinal cord survivor. So he's C6, C7 level. So for those who are not familiar with this, basically he's not able to move his hand, upper limb and lower limb very well. Then I was doing exercise with him, and I saw this tattoo on his palm. He has this word called no regrets. No regrets. And then we started to have this conversation about that, and he started to share with me, despite he had just had an injury, he was actually very positive about it. And I felt that if my patient, we will tend to call them patients in the hospital, but in the community we call our patient clients, right? Actually, if my patient can be that positive about how he is, right, despite what he's going through now, I felt that no matter what kind of challenges I have in the future, I can overcome them. Right, so that is really quite memorable to me, having that and linking it to also how I can learn from him, his outlook of life. Right, so of course, in the community, I do have clients who are a little bit more frail, I would say, and I find that one of the oldest clients I have is over 90 years old. Right, she still wants to achieve, to be able to do things by herself, and I find that is very empowering because sometimes in our context, in our environment, right, we often rely heavily on helpers, right, to help us with our daily chores and all that. And sometimes unknowingly, we let go of our, we become too dependent on them. And this client I have, right, no matter how, even though she has difficulty, right, she's not able to put on her clothes very fast and all those things. But that's fine, she said, give me time and I'll do it. So I find that often, when we deal with people, be it in acute or in different phases, right, different settings, right, it's really giving them the opportunity to be able to do things for themselves. And I find that empowering. And that is also the message that we want to emphasize in NTUC Health, which is really let our clients be independent as possible. They can do it. Let's not take over their task and take over their role. So with that kind of philosophy, I think that we approach our seniors from that lens. Find that then actually they themselves becomes a little bit surprised that they can actually do things, and their family becomes surprised that, oh, actually my mom can do this. So I get that a lot from their caregiver when they come in to see the assessment. They say yes, they can. So you just have to let them do it, right? So hopefully, I think that is that helps that's encouraging for those who are wanting to consider healthcare, consider a therapist, as a career path in life.
Thank you, Irene. we will take 2 more questions before we end off the session. So this question is with regards to the management track that both of you mentioned previously. So when will they decide on within the career itself to specialize in? And will they be able to choose which track they want to go into, or does NTUC Health choose on their behalf?
Maybe I take that question. The direct answer to the question is yes, you get to choose yourself. Because increasingly with a lot of young students or young entrant into the workforce, right, it's very hard for me to choose for them anymore. The organization do not decide. Actually, we provide opportunities. It's almost like your university where you have many modules in the curriculum. You go and pick the curriculum that best suited to yourself. Increasingly, if I take my lens back, right, I think there was a question on the management track. Actually, for early days in your career, right, what you need to think about is the sector and the industry you want to go in. A few things you think about. Number one, you think about is a sunrise sector or is it a sunset sector as an industry? You think about whether there's opportunity to create new things, or you just want to go into somewhere is very established, like a banking sector, for example. Very established, you go in, they also have management associate program, you follow a very structured career path. That's also one opportunity. Or I think I saw the notes, one question, whether you go acute setting or ComCare setting. The difference in some of these large settings, right, I would say is one thing. The good thing is that they have very structured and established career path because they have been there for a lot more longer years, and therefore it's very established. But you must ask yourself this question: as a young person coming out to the world, do you want someone to chart your career for you, or do you want to have it in your own hands to chart your own career? I take myself for example. I never allow someone to charge my career for me. I always think about where I want to learn and how I want to grow. And from there, I was thinking, okay, I need to go and do HR, then I need a technology background because when I was in DBS Bank, Piyush Gupta said technology is the future of the world, right? So I go and rotate from HR to do technology. And boy, it was like a upside turn for me. But did I emerge fine? I emerged fine. Was there hardship? Yes, there was hardship. But I find that this whole journey about life, right, is all about taking some risks in your career, making some decision that you decide for yourself. The most important thing in making those decisions this is where I always advise a lot of people, please make informed decision. You need to know about the setting. You need to make sure you know, talk to enough people to understand what is happening in the sector, what is growing, what is not so growing. More importantly, you need to know yourself. If you are someone who values relationship, who wants to build long-term career or long-term sustainable work in your profession that you pick, right, then that's where you make a calling. But if you're somebody who say, hey, I want to be empowered, I do different things, I want to try out different sectors, that is actually perfectly fine as well. Especially when you're coming to the workforce, don't let one setting deter you from considering other setting. So what do I mean by that? You can come into the ComCare setting, later on you say you don't like, it's too unstructured, I want to go into the hospital environment. Not difficult. Or if you decided you went, I heard acute care better, got nursing progression all the way, also can. You go there, then you decided, hey, actually not your personality, not your cup of tea, you say, no, I decided to come and join a ComCare setting. Maybe it's more suited for your personality or your career ambitions and all that. So there are pluses and minuses to each of the sector and each of the organization. But important is to make informed decision by talking to the right people, and then ask yourself, what do you really like, or what's your personality like? I think these are the two important factors that drives your decision. But never let someone else to determine for you. The organization is just a platform where you play to your best. Or I say play because in this time and age, and not talk about even when I was your age, I always like to play, and it's like I always tell my HR team, it's like gaming. You play level 1, you do level 2, then after level 3, you go level 4, and you aim to progress into the next level. And I think that's the whole big part about career life integration.
Thank you, Joan. I'll move on to the last question. So we understand from the previous few sessions, including today's session, that community nurses and allied health professionals in the ComCare sector, they are empowered to make more decisions as compared to the acute hospital. We would like to for your panelists to actually comment on this sentence. What do you all think about this?
Irene, you can comment.
Okay. When I interview people who want to join us, first thing I say, will you come to our center? Okay. you are literally in charge of the center. You have to be a therapist. You have to see your clients, right? You have to manage, a little bit of their social aspect. You have to call them. You have to make decision on when you're going to see them. You're going to decide. You will work with the center in manager, in the senior center, to also organize what are programs in the center, right? And then you have to sort of look after your support staff who is supporting you in the center, right? You have to also train and educate. So there's a lot of time where you have to make decision. Okay, so for that, I would say definitely in the community, you have to have quite a bit of diverse knowledge, right? To know that how you're going to influence, or what you're going to refer, how you're going to refer your clients to other services in the community as well. If rehab is just not what they need, right? So definitely you are already straight away like literally managing your center, even inventory things, like audits as well. That happen quite often in the community as well. So you do have to already grow in those different skill sets already once you're in the community lah.
Actually, it's not a criticism. It's more about, like I mentioned a bit earlier, right? In large organization, right, you actually have very established function like Irene quoted, like an audit division lah, like a risk management lah, like a public relations department. So a lot of the things you end up. I noticed some of the candidates where we talk to, right, they have very specialized role, but the moment you put them in the comcare setting, last time hospital have this, now they don't know how to do it. So actually it's actually good and bad. It's just different setting. So for young people, that's why I say very important is you really got to decide what your personality is like. If you like someone very structured, very predictable type of work, joining the hospital is not such a bad thing actually. But if you're someone who say, no, I'm still young, I want to try different things, I want to experience different things, I want to be empowered to make a difference, right? Then Comcare is definitely one setting you should consider. And then the advantage is that if you come into the setting early, right, this means like compared to your friends, you will have a lot more mileage in terms of building. But what's not so good is then you will learn now. You have to, hospital have this, better go and find out how to do this. So for someone like Irene, she probably have a lot of networking in the hospital to find comparison. But for me, someone who is from the non-from hospital, Irene, why must do this? This one very hospital, no, we don't have this setting like that, So this is some of the check and balance that we have as an organization. So that's how I will add to this.
Thank you both. Before we end of this session, do any of you have any final advice or final words that you would like to say to the attendees?
Attendees, Irene, you want to go first or you want me to go first?
I can say, I think like every different place has its own different unique features, right? And I think how I appreciate the community is the broad spectrum of it, right? So I don't just grow as a therapist in depth, but I grow in width, like in the breadth of things that I have to consider, right? And that is what excites me because it still triggers me to learn. It still triggers me to reflect, and also to find resources if I don't have those information. And I suppose those are very important skill set as we move, into the future, right? These are all the future proofing skills in the way that we need to have as well. So I appreciate that in the community, and I can see also the difference in how the therapists in the community handle things from, how I have coached or trained juniors in the past in the hospital as well. But each has its own unique like really, there's no right or no wrong, right? But I feel being able to explore and knowing yourself, I think as what Joe has mentioned, is very important. So I guess the years ahead, right, it's going to be very exciting for the community care sector. As what we know already, the government is going to do the 3 beyonds, right? Beyond hospital community. So I think, so definitely everything is developing, right, in this aspect. So there's more to look forward to. And for sure, to persist and to adapt to environment is very important.
Okay, maybe for me, I think Asia a little bit humble, so I won't be so humble. I will talk a little bit as long as I'm in this job in looking after NTUC Health as a HR person, right? One of the things you can appreciate, right, that the NTUC Health management team is actually very grounded across from the CEO, which is Sue Yi, to my peers like Irene, even Doctors Siu Ho, Linda Chu, some of my colleagues. We are very grounded people, and we actually take effort to go to the ground to hear, to understand what's going on in the sector and what the change that we need to keep key things that we need to make. The other thing that is very important here, we work in a very agile and collaborative manner. I think for future our work as an organization, right? Yeah, I mean, you hear in the media about digital adoption and all that. Actually, digital adoption is one of the what I call the business transition. But what underneath the digital adoption is really the people needs to be working in a more agile manner, in a more adaptive thinking manner. And that I would say that the NTCL management is truly on that journey already, if not for anything. And you get to see Sui in orientation, you get to talk to her in person in many aspects, and you get to hear direct from her in cascading of goals and the meaning and the purpose at the community care sector. Not all large organizations can support this because we are at the right size. We are able to support some of these direct engagement, and for all these for some of the young scholars out there, right, this is very important because you get to hear the purpose and the goals of the organization, and you make a difference to your work every day. I would say that not every organization can support this, especially the very, very large ones, because it really takes a lot of infrastructure and effort to make that happen. So I think that's one of the things I want to land with some of you.
Thank you, Irene. Thank you, Joan, for your insightful sharings and for this really nice Q&A session that we can actually talk through all the different questions that our attendees have. So we have come to the end of this session, and we hope that you have enjoyed and benefited from this sharing. So if you have enjoyed this session, please take a few seconds to rate this program at the bottom left of your screen. Our next session is Make a Difference in Community Care, Home-Based Care with St. Luke Eldercare tomorrow. And it will be the last day, and it concludes our Healthcare Scholarships Virtual Experience 2021. So St. Luke's Eldercare will be sharing on home-based care delivery in ComCare. And home-based care allows them to reach out to seniors who have challenges accessing services in the community. This continuity of care is especially important for seniors who require further care after being discharged from a hospital. There will also be sharing of career experiences by a community nurse, physiotherapist, occupational therapist, and medical social worker, panel dialogues and Q&A sessions with the participants. So we look forward to seeing you in our upcoming sessions, and go on and have fun as you dare to care in our online webinars and virtual activities. Thank you.
Thank you. Bye-bye.
Have a good afternoon.